Hi doctors, focus 39th day, and there are some 2 to 3 days pending is there. So in coming days, I'll be adding 2 to 3 videos in a day and we'll cover the topics. Now come to the topics today. Today, these important topics of vitamins, which is very important. 2 questions can come from this area. And in 2024 NEET, they asked 2 to 3 questions, 2 to 3 questions from vitamins. This is a part of community medicine also, biochemistry. Okay, this is very important, vitamins. Okay, and seizure disorders in pediatrics. So seizure disorders in pediatrics, aortic dissection, especially the classification. You can see the diagram here. See, you can see the diagram here. And QSOFA and SIRS score in surgery. So today contents are very small. You can watch it first, but this is very important because this can be a potential question. Okay, see what you can see from this image. What is this image? You can see a necklace type feeling. Yeah, this is Castle's necklace. Can you see here this eye? You can see some, yeah, this is known as bitered spots. So these are regularly asking question and people know this, and just in a span of 15 to 20 minutes you are going to by heart this and you are going to score that topic. Okay, so this is very important session. I'm expecting 2 questions for NEET 2026 from this area. 2 questions sure. One is definitely from vitamin, one is either from seizure disorders or the DeBakey or Stanford classification or the QSOFA, or 2 questions from vitamins also can come. Okay, this is very important. Now we'll go and see the important vitamins. So we know we have vitamins. Vitamins are fat soluble and water soluble. Fat soluble known as ADAC. Okay, ADAC, and water soluble are B and C, BC. Okay, so these are important. So here what I am going to tell is vitamin D, it is purely ortho. Okay, it is purely ortho. So that we'll discuss in ortho sessions. Okay, separately we'll discuss. So vitamin A, vitamin D, vitamin E, vitamin K, A, D, E, K, ADEC, these are fat soluble. BC, it's water soluble. So we have to know some other points also. What are the endogenously synthesized vitamins? These are vitamin D and vitamin B3. Very important. Vitamin D from the help of sunlight and vitamin B3. Okay, these two are endogenously synthesized. By bacterial flora, vitamin K, biotin and pantothenic acid. So this is also very important. So vitamin K, when any newborn baby, we are giving vitamin K injections. Okay, that also important. So now we are going to see the vitamin A. So we'll go and discuss about vitamin A. So vitamin A, which is very important, just I am going to discuss its deficiencies. Okay, so vitamin A in eyes, it has some features. Earliest sign is loss of vision to green light. This can be a potential question. So nowadays question will be factual. Okay, 2 to 3 sentences will come, 4 sentences will come. They may tell both are correct, both are incorrect, A is correct, B is correct, or sometimes they'll tell find the false, find the not true, and like that they'll put, and they will ask. So earliest sign of vitamin A deficiency is loss of vision to green light. Is not what, red or blue. Why? Vitamin A, the green vegetables like spinach. So vitamin A is rich in these green vegetables. So you didn't eat green vegetables, you are losing green light vision. So that is the first sign, earliest sign. Clear? So you are not eating green vegetables, that's why vitamin A deficiency, and body is like green है तो not eating है ना, so green को खराब करता है, so green vision is lost. Symbol. That is, this is the earliest sign. Okay, what is the first symptom? So first symptom is night blindness. So first symptom is night blindness. So you know what is symptom and sign. We are what we are analyzing. Symptom, the patient is expressing. So night blindness, patient is like night blindness. So that is the first symptom. And we can see conjunctival cirrhosis and bited spots. This also will happen in eyes in vitamin A deficiency. So you can see here this image. You can see this is nothing but the bited spots. Okay, this is very important. Okay, clear. And this vitamin A is essential for skin also. So in the deficiency of vitamin A lead to some problems in skin. So associated with, especially with the keratinization, and it can cause follicular hyperkeratosis, lead to a condition known as phrinoderma, known as toad skin, or phrinoderma. You can see here, phrinoderma, toad skin. Okay, this is also very important. These two questions only they usually ask, and you should know in community medicine, we have this WHO classification of xerophthalmia. Okay, so this classification also very important. So XN to XF. XN is night blindness. This is the first symptom, night blindness. And X1 is divided into X1A and X1B, X2, X3 and XS and XF. So X1A is conjunctival xerosis and X1B is bitoid spots. So here we can say B4B, bitoid spots. So it is 1B, it is bitoid spots. So you can write like this also, bitoids, BI. So you write like this, 1B. So 1B is like BI, bitoid spots. Clear? These are the simple mnemonics and they will ask what is 1B. So nowadays question can come in little deep also. This will be simple once you understand this. So green light को damage हो जाता है because of green leafy vegetables we are not eating, and BI is 1B. Clear? Very simple way I am telling. Okay, and X2 is corneal cirrhosis. Okay, so we have conjunctival cirrhosis. First the conjunctiva is affected and the bitoid spots. This is slowly going to cornea. So conjunctiva first, cornea second. Clear? That's why 2 corneal cirrhosis. X3A and X3B. X3A is keratomalacia affecting less than one third. X3B more than one third. So keratomalacia, thinning of the cornea. So conjunctiva is affected first, then cornea, then thinning of the cornea, less than one third, more than one third. Clear? Simple. So what I can say from here, first conjunctiva problem होता है, first conjunctiva problem होता है, second cornea, and third thinning of the cornea. That is keratomalacia, less than one third, more than one third. Clear? Simple. Then everything is simple only. X is for some scar, S for scar, F for fundus. So very easy. We can say here very easy. So yeah, I will erase here. See. Then so XS, S for scar. XF, it is for fundus. So clear? And you have to know 1, 2, 3 order. 1, 2, 3 order. 1 is our conjunctiva, 2 is our cornea, third is cornea thinning, that is keratomalacia. So in that order it is there. Okay, and you should know bitoid spots and toad skin or phrinoderma. These are very important. See, we had summarized vitamin A in this single page, and there are potential 2 to 3 questions can be asked. So green light ka thing they can ask, night blindness, bitoid spots, phrinoderma, and see from here 1B is bitoid spots, 1A is not, it is conjunctival cirrhosis. This is very important. Okay, now you are understanding something. BI, IB, 1, 2, 3, conjunctiva, cornea, corneal thinning, S4 scar, F4 fundus. Clear? Simple. Now we are going to the other vitamin. Now we are going to discuss about vitamin E and vitamin K. So we know vitamin E is tocopherol. Many people, we used to prescribe vitamin E, or people are going to the medical store and taking vitamin A because this is a most potent antioxidant. Most potent natural antioxidant is nothing but our alpha tocopherol, that is vitamin E. Clear? And vitamin K. So we know vitamin K whenever we studied pathology, it is associated with some bleeding disorders because of some factors. Okay, like 2, 7, 9, 10. 2, 7, 9, 10. So these clotting factors are associated with vitamin K. So that is why vitamin K is very important. That is why any neonate, the vitamin K level will be low. We are giving vitamin K injection in the intramuscularly. Okay, immediately after delivery. So vitamin K, phylloquinone, menandione, like that it is there. Why? Because this is very important. Post-translational gamma carboxylation. So this is biotin independent. So for post-translational gamma carboxylation, vitamin K is important, and clotting factors 2, 7, 9, 10 is associated with vitamin K. Okay, that post gamma carboxylation 2, 7, 9, 10, these are very important. So what happened? Vitamin E deficient, what we can say? So vitamin E deficiency, this is our natural antioxidant. So this is our natural antioxidant. So it will cause some spinocerebellar ataxia, peripheral neuropathy, and hemolytic anemia. Okay, but vitamin K bleeding manifestation and increased PT, BT. Prothrombin time, bleeding time is increased. So what are the bleeding manifestation? Nose bleeding, gum bleed, bleeding from the wound, and heavy menstrual bleeding, HMB, and blood in urine and weak bone. This will happen due to vitamin K deficiency. This is very important. Okay, clear. So vitamin K ka toxicity, when vitamin K is excess, it will cause hemolysis, hyperbilirubinemia, and kernicterus. That is also very important. So this is the important. Usually vitamin A they won't ask. Vitamin K is potential question are regularly asking, and many people know 2, 7, 9, 10 vitamin K injection in neonatal period and the bleeding manifestation. So it is associated with the bleeding and coagulation disorder separately in hematological session. So this is vitamin K and vitamin E. Now we are going to see the water soluble vitamin, especially B and C. Now we'll see the best thiamine. So whenever you tell about thiamine, that is vitamin B1. So it is nothing but T4 toddy. So what we can say, T4 toddy. Toddy means alcohol. So those chronic alcoholic people, this B1 thiamine will be deficient. So in the management of alcoholic disorders, thiamine injection is given. So that is why it is very important. Okay, this is very important. So we can see what are the active form and functions of vitamin B1 thiamine. You can see TPP. Okay, and multi-enzyme complex pyruvate dehydrogenase, alpha ketoglutarate, branched chain keto acid dehydrogenase, and transketolase. These are very important. Okay, TPP and pyruvate dehydrogenase, alpha ketoglutarate dehydrogenase, BCKDA. So branched chain keto acid dehydrogenase. These are important. Transketolase. These all are active form of thiamine. So it is linked to many metabolism. Okay, so especially deficiencies happen in alcoholics, and it lead to some condition called wet beriberi, dry beriberi. So vitamin B1, okay, thiamine, and leads to a condition called beriberi. Okay, beriberi. So it is two types, wet and dry, both are there. And dry beriberi, it is affecting the central nervous system, peripheral nervous system, and in wet it is like high output cardiac. It is wet, heart is full of water, so it's like edema. You can see wet beriberi and pitting edema. You can see the pitting edema in wet beriberi. So this is very important. Okay, and when it is comes to alcoholics, we have something called Wernicke's encephalopathy and Korsakoff psychosis. These both are due to B1 deficiency. This can happen in B1 deficiency. So Wernicke's encephalopathy, confusion, ataxia, and ophthalmoplegia. This is the triad of encephalopathy. So confusion, ataxia, and ophthalmoplegia. These are the triad of Wernicke's encephalopathy and Wernicke-Korsakoff syndrome. So these are like amnesia, confabulatory psychosis. This will happen. This is going to psychosis. So Wernicke-Korsakoff syndrome, it is Wernicke-Korsakoff psychosis. Okay, so these are mainly due to vitamin B1 deficiency in alcoholics. Okay, clear. So you can see I had kept examples of dry beriberi here and wet beriberi here. So edema, and what are the other features like that? Korsakoff syndrome you can see here, Wernicke's encephalopathy you can see here. So everything I covered in a single PDF sheet. So you can watch about B1 thiamine. Thiamine is very important. So dry beriberi, wet beriberi, and they will ask this. This is related to psychiatry also. So it's very important. Okay, and pitting edema and dry beriberi, CNS, PNS involvement, everything is very important. Now we are going to see the not frequent one but important, riboflavin. So riboflavin is B2. B2 is riboflavin. Okay. So B2, so it is associated with FAD and FMN, flavin mononucleotide. So riboflavin, flavin. So that's why riboflavin, FAD, FMN, and acetyl-CoA and succinate dehydrogenase is there. And it is causing some condition known as chiliosis and magenta tongue. You can see here it is the magenta tongue. So you can see the classical magenta tongue here. See, you can see the magenta tongue. And it can cause cystoid macular edema, CME, and corneal vascularization and all. Okay. Mainly chiliosis and magenta tongue. Whenever you see a magenta tongue or picture like tongue like this, and this is associated with FAD or FMN, it is riboflavin. So flavin, riboflavin, Okay, done. Now we are going to see the another important one, which is very, very important. Niacin, it is vitamin B3. So because of 3, it has 3D. So 3D symptom lead to 4D also. So that is also important. So niacin, vitamin B3 associated with the NAD plus NADP. So DD. So NAD plus D. So 3D. What are the 3D? This disease is known as pellagra. So 3D will become 4D whenever not treated. So dermatitis, dementia and diarrhea. These are the classical 3D. Dermatitis, dementia and diarrhea. If not treated, it will go to the 4th D known as death. Okay. So what is the dermatitis? This is photosensitive. So you can see photosensitivity to skin, and this is a castle necklace. This is very important. Okay. And dementia. So dementia will occur, and sometimes psychosis, depressive psychosis and diarrhea. And 4th D is death. So it is because of vitamin B3, which is linked to NAD plus and NADP, D for 3D, 4D. So whenever D, okay, clear. So that is niacin. So riboflavin, magenta-tine, chiliosis and niacin, vitamin B3, 3D, 4D, castle necklace, like that. Clear? Symbol. So whatever they are going to ask in exam, that only I am discussing here. I am not going in detail, not going in the what are the detailed enzyme pathway. Whatever we want in exam, I am discussing. If you read this, at least you can eliminate the other option and come to the answer. Like that I am preparing this session. Now we are going to see the vitamin B6 and vitamin B5. Vitamin B5 is known as pantothenic acid. So it's a pantothenic acid. So you can see coenzyme A. So it is linked to pantothenic acid. So it is known as burning food syndrome, covalence burning food syndrome or bar nutritional myalgia. So deficiency of pantothenic acid lead to burning food syndrome or nutritional myalgia. Sorry, it is myalgia. So it's burning food syndrome. So B5 pantothenic acid, it is burning food syndrome. It is important. Okay. So 5 is our 5 B5 pantothenic acid, 5 finger food. So food, burning finger, burning food, like that it will happen. So pyridoxine, which is very important, pyridoxine. So pyridoxine is vitamin B6. So it is very, very important. Pyridoxal phosphate, PLP, which is the enzyme here, transamination, decarboxylation, ALS in this. So you can see multiple functions of PLP. Okay. So the deficiency lead to pellagra like symptoms. Okay. So I can say pyridoxine, it is 6. Okay. P4P, PLP, P4P, pellagra like syndrome. It's like PPP. Okay. And it can cause peripheral neuropathy. P, another P. So all P's are coming here. So P's. So pellagra, pyridoxine, pellagra like symptom, peripheral neuropathy, PLP, all are pyridoxine B6. Clear. So it can cause some convulsions and anemia, microcytic anemia, sideroblastic anemia can also. So this can also cause anemia. It is important. Okay, oxaluria, homocystinuria, because it is related to PLP, pyridoxal phosphate, which is the coenzyme. So pyridoxal phosphate. Okay. Transamination, decarboxylation, ALS in this is essential for anemia related. Okay, clear. So all P's B6, pantothenic acid 5 finger food, burning food sensation. Clear. Now I'm very simple one pathology you are studying multiple time. Vitamin B9, that is folic acid, and vitamin B12, that is cobalamin. So it will lead to megaloblastic anemia and other anemias. Anemia session, you are studied anemia section, and here they will ask the clinical questions. For example, a lady who have already folic acid deficient due to neural tube defect. So folic acid due to neural tube defect. So the dose of folic acid will be 10 times instead of 400 microgram. So how they are taking, that is important. So this is important in gynecology, and this is a simple question. And B12 cobalamin deficiency will lead to megaloblastic anemia. Management also important. Okay, and what are the clinical features in megaloblastic anemia because of the B12, that is also important. So once you come to individually, you can see here folic acid tetrahydrofolic acid, okay, one carbon metabolism, okay. So here it is strictly seen in non-vegans, non-vegetarians, non-vegans, okay. Megaloblastic anemia, homocystinemia, neural tube defects, okay, clear, very important here, you can see, very important. When it is coming to cobalamin B12, so enzyme is adenosyl B12 or methyl B12, methyl malonyl CoA mutase, and homocysteine methyl transferase, whatever related to. So it can cause strictly in vegans, vegetarians. So there will be a clear cut of vegetarians. So vegetarians who are not taking egg and all, they will develop this. So megaloblastic anemia, homocystinemia, methyl malonic aciduria, mainly megaloblastic anemia. You can see the megaloblastic anemia features like hypersegmented neutrophil, macroovulocytes. So macroovulocytes you can see, and the teardrop cells, whatever. So that is also very important. It can lead to this B12 deficiency, can lead to a condition called SACD, subacute combined degeneration of the spinal cord. It is important. And bilateral peripheral neuropathy, SACD, both are the features of B12. This is also very important. And megaloblastic anemia clinical picture, this is more of pathology. Okay, clear. So this is the vitamin B9 and B12. You should know the dose of folic acid in the T1 first trimester. It's also very important. Whenever any young couples planning pregnancy, they have to take prophylactically folic acid to avoid the neural tube defects. Okay, very important. Okay, neural tube defects also pediatrics may regularly asking radiology image based. That is important. Image based. So last one, vitamin C. So vitamin C, whenever we will vitamin C, we know amla, gooseberries. So vitamin C, ascorbic acid. So this function is hydroxylation of lysine and proline, for essential for the collagen. So vitamin C for collagen. So any problem wherever collagen, the hydroxylation won't happen. It will cause deficiency, lead to scurvy, follicular hyperkeratosis, scorbutic rosary, pseudoparalysis. You can see the hemarthrosis and Barlow syndrome, like that. So scurvy. So what happened? Bleeding gums and sphincter hemorrhages, hemarthrosis in the joints, bleeding happen and it will swell and hemarthrosis will be there, and it causes pseudoparalysis because of the hemarthrosis, like that. So vitamin C is very important. So in orthopedics, X-ray findings of rickets and scurvy, these are very important. So you have to refer this also. One day class may we will see this X-ray findings of rickets and scurvy. Okay, so this is the problem of lysine proline hydroxylation, which lead to the damage of collagen, lead to scurvy, and this pseudoparalysis, hemarthrosis, bleeding gum and sphincter hemorrhages. Okay, and amla, gooseberry is important also. So this is vitamin C. So here vitamins may we discussed vitamin C, and we discussed vitamin B complexes, B, C, water soluble, A. D will be completely discussing in where? Orthopedics. So B is related to bone metabolism. This is very important. Okay, we'll discuss it one day there. The summary of the table we'll discuss. That is also sufficient. So vitamin D, which is synthesized in our body because of the sunlight also, and vitamin B3 also are important. Now now we'll go and see the very important topic, seizure disorders in children. And potentially one question can come from this. Okay, so febrile seizures, they asked already, what is febrile seizures, what are the simple, complex, major, minor risk factors, like that. So risk of future seizures disorders. So febrile seizures, we know, is the commonest cause of seizures in young children. 6 months to 6 years is the most common age, and no evidence of CNS infection. So like that. And it is simple febrile seizures is there and complex is there. Okay, so whenever is dividing these two, simple seizures, it is like GTCS 1 episode. So tonic-clonic seizures will be 1 episode, that is general tonic-clonic seizures 1 episode, and duration will be less than 50 minutes. Okay, and does not increase the risk of epilepsy. That is simple seizures. Simple seizures like 1 GTCS will be there. It should be less than 50 minutes, and there is no risk of future epilepsy, like that. But complex seizures have multiple episodes and long duration, slight increased risk of epilepsy. You should know these facts because they will ask these facts. Okay, clear. When we know major risk factor, minor risk factor. This is the question they already asked, and this can be the potential question again. What are the major risk factor? Age less than 1 year and duration of fever less than 24 hours. Imagine fever crossed 24 hours, means 1 day over, 2 day over. The risk is coming less. Okay, so it is like less risk comparatively the first day. So first day high fever, chance of this seizures, it chance will be there. Okay, GTCS ka chance will be high in the first day within 24 hours. So less than 24 hours and fever with 100 and 104 to 100.4 to 102. So this temperature run 100.4 to 102.2. This is more risk, major risk. Okay, what are the minor risk we can see? Family history of febrile seizures. So family history is there, family history of epilepsy and complex febrile seizures are happened at, and male gender is a minor, and daycare and lower serum sodium at time of presentation. So sodium is low at the time of presentation, that is minor risk. So you should know the major risk and the minor risk they will ask. Okay, so what are they will ask, like question like what is the what is not in the major risk, what like they'll ask. So age less than 1 year, duration of fever, like that. So here they can add 1 point from here. For example, they can add male gender, they can add the 24-hour difference, so they will put more than 24 hour. So like that they can make the question and come up with you, and you will make simple mistake and you will lose your valuable 4 mark and you will lose 1 extra mark also. So this is very important. Febrile issues definitely they are going to ask this year. Okay, and these are the summary of seizure disorders in pediatrics. So we have something called, we have different disorders. So one is absent seizures. One, so absent seizures, juvenile myoclonic epilepsy JME, and West syndrome known as infantile spasm, West syndrome known as infantile spasm, and SSPE. So it's a chronic complication of measles. Okay, solely. So this is not that important, but this is important in INICET and all. So we will see absent seizures. Name is there. This is happening in school going children. A school going children developed some features. Some she's not proper seizures are there. Some tongue by loss of consciousness. Something happened. So EEG suggestive of 3 spike and wave. Okay, EEG suggestive 3 spike and wave. So what are the drug of choice for this is sodium valproate. So we'll come to that. So JME, juvenile myoclonic epilepsy, seen in adolescents like 14 years, 16 years. Here 4-6 polyspike and wave, 4 to 6 polyspike and wave pattern, and sodium valproate. So in both these cases, where absent seizures or JME, the management through sodium valproate. But this is not the potential question area. So this is not the potential question area. Potential question will come simple like absent seizure. A school child is standing in the line in the assembly. Suddenly he developed some features like this and loss of consciousness, but there is no proper seizures. What is the management? Sodium valproate. What it will be? Absent seizures, like that. And in juvenile myoclonic epilepsy, some myoclonic movements will be there and epilepsy will be there. Clear. And when it comes to West syndrome, question is coming from here. This is known as infantile spasm, and it has some jackknife seizures. Jackknife, there is a jackknife seizures will be there, and salam spells will be there. This is classical, and it starts in less than 1 year, and it's having EGG shows hypsarrhythmia, high voltage spikes in chaotic background. So high voltage spikes will be there in EEG. High voltage spikes will be there. This is known as hypsarrhythmia. So this is very important. The first line drug of choice is ACTH, adrenocorticotropic hormone. This is very important. Injection ACTH is the drug of choice of this West syndrome. Okay, infantile spasm. And second line is vigabatrin. But if this is happening, this West syndrome is associated with tuberous sclerosis, the drug of choice is vigabatrin, not the ACTH. So this is the potential question here. So till now they asked here, now they can ask here. So vigabatrin is the drug of choice when this infantile spasm or West syndrome is associated with tuberous sclerosis. This is very important. Okay, and SSPE, complication of measles, this is very dangerous. It is fatal. Okay, anti-measles IgG antibody in CSF. This is the diagnosis. This is very important. SSPE. Okay, it's a panencephalitis because of the measles infections. Okay, this is very dangerous, and you can see the Redemacher complex, slow wave complex in the EEG. So this they can ask, but not sure. But this is more of an INA-CET type question. But nowadays the question pattern is changing. Exam number of question is coming down. They can make the exam tough. They can ask this. So SSPEs. Okay, so this is a panencephalitis caused by the post measles infection, and it causes some Redemacher complex, slow wave complex, and anti-measles IgG antibodies in the CSF is the diagnosis for this. Okay. Okay. So this is a summary of seizure disorder. Especially you should know the major and minor risk factor of febrile seizures. That is very important. They will trap you there. Simple question, they will trap you. Now we are going to see the aortic dissection and this classification. Every alternate year they are asking this question. Okay, so what is aortic dissection? You know, we are not going to the theory. So most common in the male at fifth decade. So 50-year-old man, 55-year-old man with a known case of hypertension, come with some chest pain radiating to back. When chest pain which is radiating to the back, so this lead to coronary insufficiency. So you have to know the classification of this aortic dissection. There are two classification. One is DeBakey classification, one is DeBakey classification, and one is the Stanford classification. DeBakey, it is D1, D2, D3, 1, 2, 3. Okay, this is important. D, so we know 1 plus 2 is equal to 3. So A, B, that is the equation here. So we can say 1 plus 2 is equal to 3, A, B. So 1 plus 2 is coming Stanford A, and 3 is separately Stanford B. So what is this? Is important. You can see one is ascending plus descending. So you can see the type 1. This is the normal aorta. You can see here ascending aorta, aortica, descending aorta. See, only in type 1 you can see pan full completely, both ascending part, both descending part involved. That is type 1. And type 2 only ascending is involved, and type 3 only descending involved. Whenever ascending is involved, it is known as A, ascending A. Whenever ascending is involved, it is A. So in type 1 and type 2 of DeBakey, type 1 and 2, 1 is like full, 2 is above. So A, ascending. So ascending ka it is A, descending ka it is B. So you can see it is easy. You can see Stanford A is whenever ascending is there, that is 1 and 2 of DeBakey. Stanford 3 is B, simple. Only descending. So this classification is regularly they are asking, and people are making simple mistake. They are forgetting. Now you just understand ascending. Whenever ascending, that is Stanford A, and ascending and descending both are there. That is DeBakey 1, DeBakey 2 only ascending. That's why 1 and 2, 1 plus 2 is equal to 3. 1 and 2 is A, ascending is involved. B is 3, only descending is there. Simple, clear. Now we are going to see very important Q SOFA. Already questions asked. You can see there is a SOFA here, and Q SOFA. You have to know what are the parameters in Q SOFA. Systolic BP, okay, which is less than 100 mmHg, and respiratory rate, tachypnea, respiratory rate more than 22 it is, and you know altered mental status, Glasgow Coma Scale. So these are the three features, okay, of Q SOFA, Quick Sequential Organ Failure Assessment, known as Q SOFA, Quick Sequential Organ Failure Assessment Score. Hypotension, so BP, suddenly BP went low, less than 100, and altered mental status, and tachypnea, respiratory rate increased to more than 22. This is coming as Q SOFA. Score more than or equal to suggest of poor outcome. So imagine this score is more than or equal to 2 or above. It is suggesting poor outcome, very dangerous. And there is another thing I had kept here for simply SIRS criteria, SIRS criteria, okay, SIRS criteria. So you can see the temperature, respiratory rate or more than 22, heart rate more than 90, and white WBC count. So the range of SIRS criteria, okay, I had just mentioned that also. Q SOFA can be a potential question, and it is the score also you should know more than or equal to because poor outcome if it is more than or equal to 2, and systolic blood pp less, SBP less than 100, respiratory rate more than 22, and GCS, that altered mental status. These are very important. So today's topic are very small. These are very important topics also. This classification is very important, and you have to know this seizure disorder summary. This is very important. So they can ask the West syndrome only regularly. If it is SSPE complication, you should know this also. Okay. And febrile seizures, definitely major and minor, they will ask. You should know the basics also. Vitamin C, vitamin B complexes, very important. Vitamin A. So vitamins are very important. This is very essential also. So today we are done with this small session, and I am planning to make 2 videos tomorrow. So I'll be covering two videos in a day with small 50 minutes to 25 minute sessions, important 2 to 3 topics, and I am going to come with lysosomal storage disorders, LSD, lysosomal storage disorders, and Darrow-Yanet diagrams, like important topics. People are getting confusion and easily they are losing that question and losing their five marks. So I'll be coming with those topics, and I had some academics pressure and tension, like workload is increasing for me and it is very tough. I had started little late, so but still I'll try my best to do. People are waiting for seeing this, and please watch this whenever you are free time. Please watch this. Any doubts or any sessions you want, put a message to me. And medicine ka approach I had already discussed. Now I am coming up with minor subjects and some other subject important high yield topics I am going to discuss with you people. Okay, taking medicine class separately, 1 hour session classes. I don't know, after 15th of August, I may see 1 week daily 1 hour classes of medicine, important topics we'll discuss and we'll see. And the time is very important. Please try to revise. Don't go and read a new topic. Just revise whatever you studied. Make your study material crisp. Whatever you studied is enough. Go to the PYT, PYQ, revise the PYQ, PYT, score well in the exam. Ultimately, that matters. It's not about the knowledge or effort you put. It's about the score you are going to get. Try to improve your GT score by doing revision, PYQ, PYT series. Don't go and learn new things and new strategies and new materials. Stop it. Go steady, revise PBT, and be confident. This forgetting topics, getting less marks is normal. Finally, in NEET PG exam will be very simple, not like the grand test exams. It will be simple. 120 to 130 questions are simple. Only the 50-40 question will be little difficult. So don't worry. Don't lose your 120, 130 question mistakes. Okay, please revise your material. Only trust your material. Go fast, little fast. Relax. Don't quit. Okay, this is very tough period. Please understand that people will feel mentally low, depressed, weak. So that is normal. Just imagine after NEET PG getting a good rank or somewhat better rank, you have very much time, free time to enjoy yourself, and you have a best career waiting for you. The career and all we will discuss later. So don't worry. So tomorrow to video I will be uploading early as possible. So thank you so much.